The articulated pelvis forms a pelvic canal, which is the birth canal. It is different in males when compared to females because of the obvious function in parturition in the female. Hence, it is wider and broader in the female than the male. Above this canal, at the level of the pelvic brim, we have the greater or the false pelvis. The pelvic canal itself is the true or the lesser pelvis. The bones of the pelvis are as follows: the hip bone, the sacrum, and the coccyx. The hip bone is further divided into the following: a superior ilium, a posterior ischium, and an anterior pubis. Sacral vertebrae have the following distinguishing features. The 5 segments are fused to form a single bone: 1, 2, 3, 4, and 5. Only the first has a superior articular process. Dorsal and ventral sacral foramina. This is ventral sacral foramina and dorsal sacral foramina. Represent the intervertebral foramina of the upper vertebral segments for transmission of sacral nerves. Lateral sacral crests are fused transverse processes. Intermediate sacral crests are fused articular processes. Median sacral crests are fused spines. Other features of the sacrum include: the sacral body is wide and its projecting edge forms the sacral promontory. This is an important landmark in obstetrics. It has a short pedicle. The transverse process fused to form the lateral mass of sacrum on each side, which are called the ala sacrum. The ala sacrum. Coccygeal vertebrae have the following features. They are fused to form a thin triangular bone. The segments taper into a small nodus at the tip of the coccyx. It does not have any recognizable feature found in other vertebrae because of advanced fusion and degeneration during embryological development. There are 3 cavities of the birth canal. The inlet is also called the pelvic brim. The mid cavity is placed at the level of the ischial spines. The outlet is placed at the level of the lowest dimensions of the pelvic canal. For clinical pelvimetry, 4 important measurements are recognized. The first is the diagonal conjugate diameter, which measures the dimension from the lower part of the symphysis pubis to the sacral promontory. The finger is insinuated into the pelvic canal and it attempts to reach the sacral promontory. The second is the subpubic angle. This angle is acute in the male pelvis but obtuse in the female. The third is the intertuberosischial diameter. This is diameter between the two ischial tuberosities. It must be able to fit the knuckle of a hand. The fourth is the interspinous diameter. This is the diameter between the spine, the ischial spine, and the other ischial spine. This dimension is measured, however, clinically by the sacrospinous diameter, which is the diameter from the ischial spine and the lateral aspect of the sacrum. It is about 4 centimeters in length in the normal subject.